Hello and welcome to Monday's coverage of COVID-19. Health authorities here are striving to contain the latest outbreak that has led to daily numbers unseen since the early days of the pandemic here in Korea. We take a closer look at the rampant spread as well as the decision to raise social distancing to level 2.5 in the Greater Seoul area with our panel of experts later on the program. We start now with our Kwon So-ah and the latest numbers on the pandemic. Now, So-ah, here the daily tally here in Korea is hovering in the 600s today.
Yes, Sunny, and that despite less tests conducted over the weekend. We have some 8,000 less tests conducted on Saturdays and Sundays, and the number of infections did not drop accordingly. Over 4% of the people who were screened on Saturday and Sunday did test positive, which resulted in 615 infections this Monday, and 580 of those were domestic transmissions, with the rest of the 35 cases being imported cases. Now, the total caseload stands at 38,161, and we have 4 fatalities reported in the past day. Also, over 430 people who have been quarantined for the virus. Now, after the country saw a daily figure in the 600s here on Friday, for the first time in 9 months, we saw a similar figure on Sunday and unfortunately this Monday too. And if we move over to our map now, we have 440 cases in the metropolitan region, with triple digits in the capital Seoul and Gyeonggi-do province, and also a concern here in the southeastern part of the nation, with Ulsan and Busan reporting 38 and 35 infections respectively. Now, as recently enhanced social distancing measures have not resulted in a slowdown yet, the government announced an upgrade to level 2.5, which is the second highest of the 5-tier social distancing scheme here in the metropolitan region, and the rest of the nation will be under level 2 social distancing measures. Let's hear from Health Minister Bang Neung-hoo about why the government made this decision.
As of today, the criteria for level 2.5 distancing have been met, as we exceeded a daily average of over 500 cases for the week. The Seoul metropolitan region has already entered the stage of a mass COVID-19 outbreak, and we have concluded that the country is on the verge of a major nationwide spread.
And the measures will take effect beginning Tuesday and will remain in effect for not 2 but 3 weeks until the end of this year. Now, 2.5 social distancing measures means no more gatherings with people above 50 people, and around 130,000 facilities will have to shut down, while some 460,000 will have to cut their business hours.
I see. Meanwhile, on the global front, so the UK is poised to start its vaccination program this week.
Yes, Sunny, the UK is about to become the first country to administer the Pfizer-BioNTech COVID-19 vaccine. It has some 40 million doses ordered, with some 20 million people to be vaccinated, with the elderly above 80 and also frontline health workers to be prioritized in receiving the shots. Now, if we take a look at the global figures now, the UK is, in the meantime, the country with the 7th highest number of infections, recently surpassing Spain, while Italy has recently surpassed both the UK and Spain. We also have here a Southeast Asian country, Indonesia, becoming the country with the 20th highest number of infections. With that, let's take a closer look at Indonesia here, with some 6,000 new cases. This is the Southeast Asian country with the highest number of infections and fatalities. And Japan, meanwhile, has some 2,000 cases reported for the 6th straight day. That's the first time it's seeing that happen since the COVID-19 outbreak. Meanwhile, in the U.S., recently, last Tuesday until Saturday, in the span of 5 days, the U.S. recorded 1 million cases. Also, Russia with 29,000 new infections. This is also a record high. And with that, the global figure now stands at almost 67.4 million. And those are the updates I have for now, but I'll be back after the government briefing. Back to you, Sunny.
All right, so thank you for that. Staying in the international arena, we turn to the Czech Republic now, where authorities have eased COVID-19 measures ahead of the Christmas holiday. For the first time since October, people there headed out to shops and pubs last week, which are now open with capacity requirements. For more, I have Edward Sawyer, freelance journalist, live on the line. Hello, Ed.
Hello, thank you for having me on.
Right. Now, back in October, as I mentioned, a lockdown was imposed in the Czech Republic as the daily tally hit above 10,000. Has the daily tally, Ed, declined in recent days?
Unfortunately, I don't think it has. Due to recent figures that have come out, it's looking like it hasn't. Towards the end of October, it was looking like figures were improving. Therefore, the government, it kind of prompted a government response that the restrictions could be lifted, and therefore bars, restaurants, and other services such as hairdressers, etc., were allowed to be open. There has been kind of Czech Republic was kind of praised initially at the beginning of the lockdowns, so as one of the best responders in Europe in the first wave, as it were, and in the second wave, the rise of kind of a bit of complacency, perhaps, or ignorance on the part of some Czech citizens, or in the rise of also conspiracy theorists, has kind of led to an extra rise in cases, and that has unfortunately led to a deteriorating situation here.
I see. Ed, is it true that authorities have been conducting fewer tests in recent days, though?
As of last week, I believe they were. However, that figure has spiked, has risen at the weekend. There have been greater tests over the weekend, especially on Saturday. So there is increased testing that may also lead to the rise in number of cases. That's obviously a direct correlation, but it's looking like the lifting of restrictions, as we saw in the Czech Republic last week, as of Thursday with the reopening of bars and restaurants, for example, it's looking like already that the Czech Republic will go into the next band of cases, so cases per 100,000. So it's looking like they would probably go back into a further lockdown if cases continue to rise.
I see. Edward, do tell us a bit about the frequent reshuffles at the Ministry of Health in light of the pandemic.
Yeah, firstly, I would kind of echo that it's a very tough job. I wouldn't necessarily envy anyone in that position right now, and Czech Republic isn't necessarily alone in the pressure on health ministers and health advisors. Especially, I'm British, and it's been very. There's been lots of switching in the UK as well. I think it's a very tough balancing act with the measures, imposing strict measures, but then also, keeping the economy flowing and businesses open. So many were pinning their hopes on a particular advisor, government advisor called Primola during the summer, but unfortunately he was let go after being photographed outside of a restaurant without wearing a mask. So which caused kind of a big scandal in the Czech Republic. Now Jan Blatný is now in place, and there's another health minister who hopefully will bring some kind of cohesion and find that right balance. But it's a real tough balancing act.
I see. All right, Edward, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Monday. The briefing is about to start. We'll come back to you afterwards with a summary of it.
Today we have Mr. Na Song-un from the Korean Disease Control and Prevention Agency. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of December 7th, we have a total of 580 new local infections and 35 new imported cases. And currently, the total caseload now stands at 38,161. Currently, we have 8,311 people remaining in quarantine, and there are also 126 patients with severe or critical conditions. And we had 4 additional fatalities, and the accumulated death toll now stands at 549. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at the major updates of our domestic infections by region. First of all, starting from Seoul Metropolitan City, in relation to a restaurant in Jongno-gu District, we have 36 additional cases being confirmed. In total, we have 112 cases to date. And in relation to an hospital in Dongdaemun-gu District, we identified 17 additional cases, raising the total to a total of 41. And in relation to a sauna at Dongjakgu District, we have identified 5 additional cases, and the total now stands at 27. And in Daejeon, in the Yuseong-gu District, we have a pub, and in relation to this pub, we have 3 additional cases, and currently we have a total of 48 people being confirmed. And in Ulsan Namgu District, in relation to a nursing hospital, we have identified 76 additional patients, and in total, we have 92 cases being confirmed to date. And in Busan, Ulsan cities, in relation to Janggu lessons, we have 7 additional cases. And currently, we have a total of 194 cases. And as for other data on the other cluster infections, please make your inquiry to the spokesperson's department following the briefing. Currently, we are at a situation where we are seeing the biggest challenge of the COVID-19 here in South Korea. And we would like to state that the current situation is not only restricted to a certain area, but is also spreading nationwide. And according to figures, study, and modeling, if the situation continues, we will also have additional of 550 to 750 cases on a daily basis this week. And during next week, we also have the cases to expect to hover around 900. And we are seeing a rapid surge in the number of confirmed cases. And during the past week, an average of critically ill patients stand at 101, which is a slight increase from the 80 from the week before. And the positivity rate now stands at 4.23%. And we are also seeing cluster infections spreading as well. We have seen a decrease in the foot traffic and movement due to toughened quarantine measures and social distancing measures. However, the effects have not yet become visible. And to this end, starting from tomorrow, in the metropolitan area, we will be elevating the social distancing level to level 2.5 in the metropolitan area. If we fail to contain the virus with this temporary halt, this spread of the virus can spread to the rest of the nation, and this also could result in our last resort of having a shutdown. And also, if we have an increase in the total number of cases, this would lead to a medical collapse and also a great difficulty and a challenge in treating our critically ill patients. And this will, in the latter term, bring a great challenge and disruption in the treatment of other diseases as well as people with other critically ill symptoms. And currently, we are at a verge of a possible major nationwide outbreak. And one of the largest challenge is securing enough hospital beds, especially the intensive care hospital beds. And it is very important for us to maintain our medical capacity, and we will also exert our full efforts to resolve this. And this crisis that we stand right now is actually the most crucial one since the outbreak, and there are three major improvement measures being put in place. First, we will also improve our epidemiological investigation capability. Currently, we have many epidemiological investigators, and they also have a large burden of work, and we are also seeing this rise as well. And currently, due to the rise in the number of confirmed cases, there are many cases with unknown sources of infection, and therefore we also need to mobilize more people who can serve as the epidemiological investigators. And in the long run, we will proactively nurture and secure enough number of such investigators. And second, we will also innovatively revamp our testing capacity. And the largest obstacle was the securing of enough samples. And in order to solve this problem, starting from September, the agency has started carrying out as a very easy and accurate testing kit using saliva, and we have been completing this research, and starting from next week we will also utilize this on the field. And at the medical field, if the patients are confirmed with the positive cases, we will also have the antibody testings as well. And if we do not have any other diagnostic kits, we will also make sure that they could be utilized at emergency rooms and nursing hospitals as well. And third, we will also have an effective use of the isolation facilities, and we will have a major adjustment to the guidelines for the self-isolations. And up until now, South Korea had one of the strictest measures in the world when it comes to self-isolation. However, with the increase in the number of confirmed cases based on the scientific research and also experts' opinion, we will be easing such restrictions and guidelines. And based on our clinical trials, we have also had 3 days of clinical monitoring after 10 days after testing positive. However, we will reduce this to about 1 or 2 days. And also after being tested positive, 7 days after tested positive, we also had the 48-hour testings. However, we will adjust it to 2 times within the 24 hours. However, nevertheless, we will also have the discretion of the medical staff to adjust these guidelines going forward. And going forward, we will also secure enough hospital beds, especially those for the critically ill patients, to deal with the outbreak. And starting from the beginning of this year, many public and the individuals of the public have took part in quarantine measures, and it is a great pity for us to have to elevate this even more. However, it is a very critical moment right now, as we have one of the largest number of daily cases, and we believe and we are confident that we can overcome this situation. And going forward, we ask you to comply with these quarantine measures and toughened social distancing measures. And if you do not feel well, please get tested as soon as possible for the safety of all. And currently, the situation does not allow us to expect the peak. However, depending on our participation in the quarantine measures, we are able to overturn the outbreak. During the next 3 months, we need to minimize the daily cases, and we also need to reduce the fatality rate as well. And also, as for the self-employed people, we need to also decrease the economic burden as well. And there will be many businesses being shut down during the year-end holidays. However, we ask you to stay and have solidarity and unity so that we can overcome the challenge once again. And the quarantine authorities will also exert our full efforts to this end. Thank you very much.
Right, that was Na Sung-woong on Monday's afternoon briefing. So do give us the gist of his address.
Well, Na said that the current situation is the most critical situation since the COVID-19 outbreak here in Korea, as we are in the third wave of the pandemic, and that the situation in the Greater Seoul area can lead to an expansion to a nationwide, a worse situation nationwide if we don't contain the spread right now. And he also had some disturbing forecasts of figures this week. We could have daily infections between 550 and 750, and even next week there is the possibility of cases in the 900s. And accordingly, we also have more patients in critical or serious condition, as that stands at 101 on average now in the past week. Also, the reproduction rate of the virus stands at 1.23%, which is also deemed a high percentage. So with these rising figures, he has been mentioning a concern of a breakdown of the health system if these figures do continue to rise. And that's also why the government decided to have a revision to quarantine standards according to the rise of patients, and also to use more manpower in contact tracing. That's also what President Moon Jae-in actually said earlier in the day.
Right, something we'll be touching upon during our studio session. All right, so thank you very much for that.
Thank you.
Right, starting tomorrow, social distancing here in the metropolitan region will be raised to level 2.5 for the next 3 weeks. The rest of the country will see level 2 social distancing measures in place. Up on the screen, we have the measures under level 2.5. Mask wearing is mandatory at all places outside of one's residence, regardless of the social distancing level amid the pandemic, and failure to abide by this personal safety precaution can result in fines of up to 10,000, 100,000 won, that is. Gatherings of more than 50 people are banned. Now, such gatherings include weddings and funerals. Also, 1/3 of all public servants and workers at public entities have to work from home. Sporting events need to take place in the absence of spectators. Meanwhile, at places of worship, in-person congregation is limited to 20 people, and online religious sermons are strongly advised, while small gatherings for choir practice, Bible study and meal sharing are banned. In the academic arena, all schools face a 1/3 attendance limit with strong recommendation for online lectures. High-risk facilities, including clubs, bars and singing rooms, are to suspend their operations, while high-risk activities such as door-to-door sales are not permitted. Cycling and horse racing tracks are closed, as are cram schools and indoor sports facilities. Public facilities such as libraries and museums need to abide by an admissions cap of 30%. Other venues such as large retail stores are allowed to open until 9 in the evening. Restaurants are allowed to accommodate in-house diners until 9 in the evening, and after that they can only offer takeout and delivery services, just as coffee shops are permitted to do. Banks in the metropolitan area will open from 9:30 in the morning until 3:30 in the afternoon, starting from tomorrow. So those are the guidelines to abide by under level 2.5. Also, in related news, local governments are working to provide the elderly with health support and others with moral support amid the prolonged pandemic. We have details up next.
With social distancing measures having been in effect for an extended period of time here in Korea, elderly citizens who are living alone have been especially hard hit by the resulting social isolation. To ensure that their healthcare needs are being met, Nowon-gu District in Seoul has started operating hospitals on wheels, in this case being buses loaded with medical equipment.
지금 같은 코로나 시대에는 주민들이 병원에 직접 찾아가는 것 자체가 두려움이 있으시고, 또 보건소 내에서 진행했던 건강이나 여러 가지 검진 프로그램들이 중단된 상태에서 어르신들에게 저희가 직접 찾아가서 건강 이동버스를 운영하고 있습니다.
Health checkups are being performed on these senior citizens, gathered today at this local community center for the elderly. After filling out a basic health questionnaire, people were given checkups and had their foot pressure measured, among other tests to assess their balance and mobility. They're also checked for their blood pressure and bone density and given health counseling on board the bus. In addition to the basics, visitors also have access to other quality services, such as chronic disease management, medication guidance, and education on general health awareness.
코로나 때문에 연세 많은 분들 다니시기도 힘들고, 그런데 이렇게 와주셔서 너무 좋고요. 그리고 여기서 의사분들도 그렇고 너무 상세하게 설명해주고 그게 너무 좋아요. 그래서 이거 자주 좀 이 이동차가 다녔으면 좋겠어요.
이제는 저희가 직접 찾아가서 경로당이나 복지관 내에서 그런 건강 프로그램, 영양 프로그램, 교육 프로그램을 진행할 예정입니다.
These moving hospitals are playing a key role in providing essential healthcare services to those who need them most amid the pandemic. A night out at the movies or at a concert hall and performing arts centers has become a distant memory amid COVID-19. To help people keep their spirits up, Gangnam-gu District is holding a socially distanced traveling concert that people can watch from their balconies. The sounds of music echo across this apartment cluster. All you have to do is open your window to feast your eyes and ears on the performance down below.
올해 1월부터 지금 현재 코로나19로 인해서 공연을 또 볼 수도 없고 자가에 또 계시는 분들이 많이 있습니다. 그래서 우리가 코로나로 인한 우울증이라든가 이런 거 활력을 주기 위해서 찾아가는 발코니 콘서트를 하게 됐고요. 상당히 저희가 기대했던 것보다도 더 좋은 반응을 또 밝혀주시고 또 심지어는 막 저 지방에서도 우리도 좀 와서 해주면 안 되겠냐 뭐 이런 그런 요구사항도 또 있었습니다.
These concerts are an ideal compromise solution that allows people to enjoy arts and culture while maintaining social distance at the same time.
올해 이제 시범적으로 추진을 했지만은 상당히 우리가 기대했던 것보다도 상당히 호응도 좋고 그래서 내년에는 좀 더 주민들의 의견을 반영하고 그래서 저희가 좀 확대를 하고 또한 이제 원래 온라인 이런 유튜브라든가 이런 활성화해서 주민들이 쉽게 접할 수 있도록 저희가 사전에 기획을 철저히 하도록 하겠습니다.
We may be in the midst of a pandemic, but it hasn't stopped people from immersing themselves in a new cultural experience.
코로나19와의 싸움에서 우리는 지금 최대의 위기에 직면해 있습니다. 수도권의 상황은 더욱 심각합니다. 거리두기의 효과가 나타날 시기이지만 유행 차단과 환자 감소 효과는 충분히 나타나지 않고 있으며 앞으로도 효과가 제한적일 가능성이 큽니다.
Right, it appears that coronavirus contagion is outrunning its containment. In response, authorities have raised social distancing in the metropolitan region to level 2.5, effective as of tomorrow, that is Tuesday. Now, the rest of the country will face level 2 social distancing in place. I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Thank you for inviting me.
And I also have Dr. David Kwak from Suncheon University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Professor Chung, let's begin with your thoughts on the government's decision to raise social distancing to level 2.5 here in the metropolitan region.
Yeah, as of midnight tonight, 2.5 will be applied in Metro Seoul area, and the rest of nation, 2.0 will be applied. I think it's an appropriate measure, but a bit late because we can see from the end of November, we could see the sudden increase of all the occurrences in Metro Seoul area. But however, I think this is the last chance to prevent the great, biggest pandemic in this country. So the next step is 3.1, which is almost lockdown of the whole country. So we must do everything, and I like to recommend people to sincerely follow all the regulation under 2.5.
Of course. Dr. Kwak, as Professor Chung has mentioned, starting from November, actually, we've been witnessing a rise in social distancing measures on a weekly basis. Why aren't such efforts working to contain this latest outbreak, though?
Well, it's more likely that people have gotten used to the differences or the changes in the regulation. We have really become complacent to end result in this increase in the number. But if I may refer back to the daily confirmed cases, the graph of it actually shows us that it might have actually started way back in October, early October, when the social distancing level was actually brought down to level 1, when we were having 50s or so daily confirmed cases by then. According to the KDCA's measurement, it seems like the reproductive number we're having is somewhere around 1.4. It might be a little slightly lower than that. If my calculation isn't too incorrect, if we multiply that over 7 times and multiply to the beginning number of the October, that reaches about 530 to 1,000 or so. So theoretically speaking, the superficial number that we're currently seeing, 600 some numbers, is right on that spot. It tells us that this is not another cluster infection stemmed increase in the number, but rather there has been a gradual increase in the daily cases, meaning it's more likely that the infection has reached far into the society now. So even if we try to take control of, in the most acute way possible, it's not likely that it's going to suddenly drop the numbers back down to the very low numbers that we used to see. More likely, the case would be that people would be scared now to actually go out if they had schedules, or it'll be more likely that people are more reluctant to actually go into physical contacts, relatively speaking, in comparison to before. So we would hope to see more of a stabilization of case numbers compared to the weeks before, and we would hope to see that numbers actually go down to some hundreds of numbers, but it's less likely that we would see, like we used to a couple months back and 7 months back, that the numbers in the a few hundreds suddenly drop down to a few tens of numbers. It's not likely that we see that currently.
I see. Professor Chung, I understand that the current rampant spread of the virus is severely hindering tracing efforts, which is why, as our consul mentioned earlier, President Moon Jae-in has called for the inclusion of police authorities in tracing efforts as well. What are your thoughts on this, and what are your thoughts with regard to Korea's current strategy in dealing with the latest surge?
Yeah, including police officers and etc. is not a bad idea. But the epidemiological investigation service is not like that, because that's a very special area in quarantine. And we need quite a long time before we have authorized epidemiology investigator. So these days we see 15% to 20% of untraced cases, or tracing still on tracing. That means it sums up for last week, more than 10,000 people, confirmed cases do not know their infection sources. So it is not probable we can see the confirmed infection sources in near future. So they will be counted as hidden, silent infectors. And as day goes by, there will be thousands of unconfirmed cases who are spreading virus in this society. So that's a pity. So I insisted on the raising of investigators before the third pandemic here, but we didn't see any good news from KDCA. But still, we are expecting there will be a more thorough investigation on the epidemiological service.
I see. Wants to have a greater number in the workforce to do that then. Dr. Kwak, you talked about how it's not possible to witness a sudden drop from the numbers we're seeing right now. We have triple digits right now. They're not going to drop to the double digits in the near future. But keeping that in mind, what are your prospects for the daily infection numbers for this particular week then?
Well, this particular week would represent what we had the week before, or possibly a couple of weeks before. Meaning, just last week we had a huge ceremonial event to our country, which was a college entrance exam. We would obviously get some sort of numbers out of there on top of what's already happening. But hopefully, because people have become much more scared to actually be in physical contact, I would predict that the domestic cases that are aside from the college entrance exam would stabilize, hopefully, and drop down below, hopefully 500 or 600. So if we add that 400 some possible numbers to possible some numbers from the college entrance exam, that'll be the number to expect for this week, which KDCA predicts would be around 500 to 750, which I would agree with.
I see. And Professor Chung, based on what Dr. Kwak has just said, the national scholastic ability test has come to an end, but there is much on the agenda of universities, including interviews, practical examinations, and so forth, as they seek to select their freshmen for the year 2021. What needs to be done to ensure safety?
Yeah, should decrease the number of face-to-face interview. So sometimes it's not easy to do that because you need a practice examination and etc. But try as hard as possible to minimize face-to-face interview cases. And while the examinees are moving, they should pay a special caution on the transportation and accommodation and when they are eating in the restaurant because people are moving all around the country. Not in Seoul area, but also in all the other countries to get the examination here and there in the university. So I think wearing masks is the most important thing for the young examinees because so far that is the most effective vaccine, which is wearing the masks. So.
Right. Dr. Kwak, there are also concerns about shortages in supplies, including hospital beds, given the recent surge in daily cases. What do you propose to better address these medical challenges, that is?
Well, if we think back early on in this year, when we had the whole Daegu area, the Gyeongbuk province outbreak, probably almost the same in the numbers that we're also seeing here. They had to recruit a lot of private facilities to care for not just the mild cases, but also the severe cases. Thankfully, we've systemized much better now that we're allocating these people in different severity of the illness to different facilities. But we're definitely going to run out of those facilities, both medical and social, pretty soon. We do need to go reach further for private sectors, not just the private facilities, but private hospitals as well, possibly paying them to yield us more possible isolation booths and negative pressure isolation booths, but also possibly for cohort medical facilities that could take care of some people having severity somewhere in between the very mild cases and the very severe cases. I think government has to think of a way to actually have these private sector hospitals, not just in the metropolitan area, but somewhere in the vicinity to actually help us really taking care of the patients.
Right. And speaking about patients with mild symptoms, Professor Chung, what are your thoughts on the idea of at-home treatment for those who have mild symptoms or those who are asymptomatic?
I don't agree with that because we see in the first pandemic in Daegu and Gyeongbuk area, we saw some patients who were staying at home because of a lack of hospital beds and they died. And several people died before going to the hospital because usually the mild cases do not go over to progress to severe cases, but some cases the patient do not know what their condition is. Then I think all the patients, every individual patient should be cared by doctors and nurses. So the Korean government developed a life treatment center, which is very good. And in Seoul area, each local government is providing a life treatment center. And the mild cases will be transferred to that. And regarding hospital beds in Korea, we have so many hospital beds compared to population. It's top ranked in the world. So there is no reason why we should keep the confirmed cases at home. And there are also some risks for the families as well. So I'm strongly against that idea.
I see. And just out of curiosity, Dr. Kwok, what are your thoughts on at-home treatment?
Well, I strongly disagree as well. At home, quarantining, it just provides so much chances for the virus not only to spread to the vicinity people, it has, as Dr. Jung mentioned, it has great potential that because the patients themselves actually do not know whether they're going to become suddenly severe, and they might even fall a very ill condition which could take their life away. So I also agree with Dr. Jung's idea that they have to be taken care for by some sort of medical personnel in some sort of medical facility.
Professor Chung, do you believe authorities should have raised social distancing measures to a higher level at an earlier date, and why you think so?
Yeah, because I don't know why the government was quite hesitating on every corner. They could increase the level of social distancing. In some part, I understand that the government is much more worrying about economic status for especially entrepreneurs and small shops and etc. But I think a bit late for the level up for this pandemic. But forget the past and we'll go for a future. But if you restrict the people and the society, then we could see ease of a pandemic sooner or later.
Right. Dr. Kwok, the test positivity rate here in Korea currently stands at 4.39. I understand this is quite a high number. Observers are thus calling for an insignificant rise, that is, in the number of tests. What are your thoughts on this?
Well, I think that's what the news today was all about. When President Moon Jae-in actually ordered public workers and possibly people in the police work to actually join in to investigate and in regards to tracings of the cases and possibly testing more people. I personally just think that it's going to reveal that more people are infected in the same sense that all these tracings that we currently have in our system had 4-point-something percentage of positivity rate. If we test more people, it's going to yield possibly more people in the 4-point-something percentage range. So would it be a good idea? I think it would still be useful in the sense that we could have those people isolated and possibly quarantined from the rest of the people so that the virus spread would stop. But would it actually change the matter that the positivity rate would decrease? I would not personally think so, just because of the situation where I personally think that the current situation is infection very deeply rooted in the society, that it's really happening much more randomly and not just by the tracings that we're really looking after.
I see, unfortunately.
Unfortunately.
Professor Zhang, over the weekend, there was much talk about a religious sermon of, I believe, some 700 people, which resulted in 3 infections because all the participants there were wearing face masks. Now, could you take this moment to remind us about the importance of personal safety measures as we head into a new work week?
Yeah, that's a very good example of wearing masks can prevent the COVID-19. I heard that there were 3 patients in the sermon, and they participated for some people participated a couple of days, and all the rest of the people could prevent from getting COVID-19 because they were all wearing masks. And one of the interesting thing is the church designated some people to oversee, survey the mask wearing status. That's a very good example. And there were some other cases in a child care center and in some shops, in some gatherings, who were wearing masks and they were prevented from getting COVID-19. So again, wearing masks is the most effective vaccine. Because if you wear a mask, I'm a patient and you're a healthy one, and you can prevent. Both wearing masks can prevent 98.5%. That's the most effective vaccine so far. The Pfizer is about 95%. So don't forget to wearing masks when you are getting out.
Right, don't forget to wear your face mask. And as Dr. Kwak mentioned previously, remember to wash your hands and to watch your distance, right?
Yes.
All right, Dr. Kwak, thank you for your thoughts. And Professor Chong, as always, thank you for being with us today.
Thank you.
Right, on that note, we end Monday's edition of COVID-19. Now, tougher social distancing measures are poised to go into effect starting tomorrow. Now, do seek to abide by these enhanced guidelines to allow for a prompt return to some form of normality. In the meantime, thank you for watching.